Good morning, everybody. This is Liz Schode, registered dietitian and director of clinical nutrition here at Jackson Purchase Medical Center, doing another Learning with Liz lesson today. And today we're going to talk about if you know someone or yourself or a family member that is getting ready to have some kind of surgery. Did you know that you can help yourself with good nutrition before surgery to help yourself with healing after surgery? This is just kind of funny with just some things that I read about this, but it says like if a person's getting ready to undergo surgery such as a hip replacement or a knee replacement, you think you wouldn't want to run a marathon right before that, but actually that's what your body goes through is the same type of thing that a person's body goes through if they're running a marathon is going through surgery. It's the same thing. So trying to help ourselves prior to surgery can really help you a lot with your recovery. So I'm going to kind of give you like 5 little tips to help with that. We'll have a little article attached to this that has those tips on there, as well as some extra helpful tips on what we really need to eat prior to it. So it's kind of it's kind of funny thinking about what I can actually help myself before surgery with nutrition, and yes, you definitely can. So a lot of hospitals now are developing I'll say call it a program for people who are getting ready to have surgery, and it's called ERAS, which ERAS stands for Enhanced Recovery After Surgery, and we're giving people these ideas of some things that you can do. So what you can do, here's 5 different tips. Ramp up your nutrition intake. So to support a person's recovery after surgery, eating more like protein can actually help that body with healing afterwards. Now, as long as somebody doesn't have kidney failure or any kind of kidney problems, eating protein is very important for them. We're going to get protein from our meats: chicken, turkey, beef, pork, eggs, cheese, anything like that has protein in that, and trying to maybe bump up your protein intake before that surgery can actually help. Even drinking, like say, a nutritional shake such as an Ensure or a Boost or a Carnation Instant Breakfast or any of the protein supplements that are out there can actually help your body with recovery afterwards. Also, making sure that you're eating some good carbohydrates before surgery, because this helps with giving extra fuel to your body. And we get carbohydrates from things such as breads, cereal, rice, pasta. We also get it from fruits, from vegetables. So bumping those things up can be very important for you also. And like I said, carb load before surgery. We tell runners to do this before they're getting ready to run a big race. Well, you can do the same thing with your body like 1 to 2 days before surgery. So trying to increase your carbohydrate intake. Things such as, like I said, our fruits, our fruit juices, vegetables, also things like cereals and pastas and rice. Those types of things can actually help to aid you, with recovery afterwards. So it also helps with hunger and thirst and anxiety before surgery. Sometimes we may have some nausea and vomiting after surgery, and if you have kind of uploaded those things in your body beforehand, it helps with that recovery because you may not eat some right after surgery, so it kind of helps with that. Also trying to support our body with some different types of amino acids. Here's 2 of them. It's called arginine and then omega-3s, which is a fat. But arginine is an omega. It's an amino acid that our body needs after surgery, because a lot of times our body will say it has inflammation in there, and using that arginine helps with healing. Having some good omega-3s, eating some meals that have fish in it before surgery. There's even an omega-3 that you can take like in a pill form, and that helps a whole lot also. And then just trying to keep our strength up. Did you know in older adults 3 days of bed rest, just 3 days, can cause up to 10% of total muscle loss in your legs. So trying to make sure that you're trying to do some walking prior to surgery if you can, even if it's sitting in the chair doing some exercises that can help, to kind of get those muscles in preparation of recovery with that surgery. So it's very, very important. After surgery, get up as soon as you possibly can, okay? I know people are like, oh, I may hurt and I want to stay in bed. No, you got to get up, you got to get moving, because that, number one, helps with the pain, and number two, helps you to recover with those muscles. So very important. And then, be your body's biggest advocate. Knowing that, oh, I need to do this prior to surgery. Do it, okay? It's very, very important with that. If someone needs help with that prior to surgery, please give a dietitian a call, because we can help you with telling you which foods that you need to eat to help yourself with that recovery. So just try to remember, we're trying to increase our energy needs, trying to make sure that we're getting those carbs and we're getting that protein in, decreasing our muscle loss. Also, we're going to have a lowered immunity after surgery. So doing like with those omega-3s helps to bump up that immune health and recovery. And, a lot of times we don't want to eat after surgery, and then we start losing weight. So, a person may need a protein supplement after surgery to help their body with, recover with that. So I hope this just gives you a few little helpful tips. We will attach an article to this talk that will give you these helpful hints and can help a person have a better recovery after surgery. If you have any other topics or questions that you would like to ask, just drop us a little line on here, and we'd be glad to get back to you as soon as we can. So I hope everyone has a great day.